picking from two evil groups of people, you know. But yeah, no, 100%. Thank you so much for that answer. I wanted to touch on healthcare for a bit. Your real introduction to advocacy has been in the context of the environment and public health. I was hoping that you could highlight the key points in your platform that address those areas. Are there any specific issues that the country is facing today?
Oh, huge. I mean, uh, for one thing, people don't have access to health care. It's like 87 million Americans who either don't have health insurance
Wow.
or they don't have full health insurance coverage.
Wow.
So, when you need to go to a doctor, you can't go because you're worried about the cost and it's not going to get covered. Or you need your insulin and you can't pay for it. Um, or other critical medicine you can't get
Mm.
because the cost is just off the charts. And so this reform, one reform, so I so-called Medicare for all healthcare system. It's like Medicare uh, before they started knocking holes in Medicare. So they have all kinds of holes in Medicare right now, but it
Yeah.
like restores Medicare to the system that most people were extremely happy with, a system where like the bureaucracy costs about 3%. The bureaucracy in the healthcare system that we have now, it's huge. If you've ever, had to submit,
Yeah.
for reimbursements or figure out what a health insurance plan you're going to have, or what does your health plan even cover? It's just outrageous. I mean, even just like a pharmacy plan. It's incredible
Yeah.
trying to keep up with the red tape. It turns out that it's one out of every three healthcare dollars pays into this incredibly complicated morass of private for-profit healthcare. And in the system of Medicare, you just have one insurer instead of a gazillion insurers, each of which have many different policies. And then it becomes this whole rat race to try to chase down, well, was that medicine covered? Did you go into the hospital and did you get a Band-Aid? Are Band-Aids covered? It's just this mess of trying to track this minutia and figure out what does
Yeah.
it cost. In a Medicare for all system, there's just one basically quasi-governmental insurer. But the healthcare itself is the same. It's still your doctor if you want that doctor. But now you have a choice. If you don't want that doctor, you can choose your doctor
Yeah.
and your hospital and all
Yeah.
that. Because under most insurance plans right now, you don't have choices at all. You're inside of narrow networks, and those networks change. And then you got to change the healthcare provider that you've had a 10-year, 15-year relationship, and they know you. So yeah, the healthcare system is a mess, but it's really easy to fix through this Medicare for all system. Most countries around the world use, that is developed countries, they provide health insurance to everyone as a human right for way less than us. We cost twice as much as the next biggest spender, which is
Yeah.
Canada. And they have much better health statistics than we do. Ours are terrible for all kinds of reasons, but including that people don't have ready access to healthcare. So let me just say that's one problem is our healthcare system. It serves health insurance companies and big pharma,
Yeah.
doesn't serve people. And then the other issue is that we're sick. We
Hmm.
are really darn sick. We have the worst health statistics of all the developed nations. And in part, that's because we have a lot of poverty. We also have a lot of pollution. Um, we also, have lousy housing, and that's very much related to, health. Um, there are just all kinds of things that don't work well in our society, and they make us sick.
Yeah.
And, the environment is a big part of that. We have kind of a society that's built for these predatory industries, whether it's fossil fuel, our energy system, our food system is run for the benefit and the profits of corporations. Farmers have been put out of business, uh, you
Yeah.
know, massively as an entire class of people. Most farms have been corporatized. It's a real struggle for farmers to exist right now. And the system of food production is really lousy. It's devastating to our water supplies and to the soil itself. It relies on toxic chemicals, which are, you know, poisoning the farmers, poisoning our food. Um, we can do this much better.
Hmm.
It's not rocket science how to do that,
Yeah.
but that's very much related to our health problems, is that we're not protecting health. In fact, our systems are making people sick.
Yeah.
So we have this very, this kind of pathological, this sickening system of food. Our water supplies are lousy, our air is polluted. Um, just across the board, we have really these lousy determinants. And then there's also, poverty and social chaos and stuff like that, which, joblessness, losing your job is a huge driver of illness. And a lot of people have basically lost good jobs over the last 20 years. Many jobs are, they're exported, and then the jobs that we have are, lousy and part-time, or
Yeah.
just really very stressful working conditions. So these are fixable problems. These are not, like some kind of God-given thing that Americans are just sick. No, we are made sick fundamentally by our political system. I used to say that I practiced clinical medicine. Now I've moved into political medicine, because
Yeah.
politics is the mother of all illnesses, and we all have to fight, for our political health, if we're going to be allowed to have healthy food and water and jobs and transportation and you name it. Right now, it's
Yeah.
all on behalf of the big predators, not the people. So there's a fundamental fix here, which is demanding that we have the democracy we deserve. And that means we have the choices that we deserve on the ballot, that we can choose if we so desire in this election.
I actually have a question from a friend of mine, well, cousin of mine, about some what you just touched on. Her name is Rajat, and she's actually a pharmacist from Oklahoma. You've mentioned that for years we've been seeing the rise in cost of prescription drugs, and she was wondering what changes would your administration bring to have more of a cost-effective way to negotiate drug prices between the pharmacy slash prescriber and insurance that would bring down healthcare costs for patients.
So this is one of the really great things about a Medicare for all system, because then all pharmaceuticals would be
Yeah.
subject to bulk purchasing.
Yeah.
So you would have this, this one insurer that would be buying pharmaceuticals for everyone. So then they have enormous clout to bargain down the cost of pharmaceuticals. Because right now, it's common for our medications to be at least twice as expensive as, say, in Canada or in Europe, but often it's like 10 times or 50 times more expensive. It's just absolutely outrageous. And the way we've
Yeah.
seen costs just skyrocket for really common medications like the inhalers that you use for asthma. The price of that has just shot up. And also like the those injections for like for
Uh,
anaphylactic,
yeah.
severe reactions and stuff like that. Those have absolutely gone through the roof. And it's not as though the components have gotten more expensive. It's just that, the drug companies have gotten more savvy about jacking up the price. So it's outrageous. And the Democrats, they pride themselves, they pat themselves on the back for passing this bulk purchasing bill. This is within the Inflation Reduction Act. It had some bulk purchasing built in. But the truth is, it's only 10 pharmaceuticals. It might be 15, but it's like some really tiny number, and there are thousands of them. There's thousands
Yeah.
of them. So it's really, that's not what the American people need. The American people are basically locked out of healthcare. There's somewhere around 70,000 deaths every year just from the lack of health insurance. And during COVID, one out of
Yeah.
every three COVID deaths, so like over 300,000 people died from not having the health insurance that would have enabled them to get proper care.
Yeah.
So, this is horrible. As Martin Luther King said, health injustice is like one of the worst forms of injustice, the most inhumane form of injustice at all. And, like to look at racial disparities in health as well.
Yeah.
It's somewhere around, I want to say 30% higher.
Hmm.
No, it's 3 years. Last I checked, which is a couple of years, but these
Yeah.
things unfortunately, they're not getting better. So this would tell you roughly where we are. The the lifespan of African Americans is cut short on average by about 3 years. And then if
Wow.
you add to that the health impact of educational differences, not having like even a high school education or college education, if you add that along with racial disparities, it turns into more like a difference of 10 years, not 3 years. And like, how outrageous is that?
Yeah.
That people's lives are cut short. You know, same thing for maternal mortality or infant mortality. They are sky high among African Americans in particular and other people. This is partly related to income, but it's also separately just related to race alone, probably having to do with just, racial bias that's built into a healthcare system, which is delivered mostly by white people.
Yeah.
And, care needs to be delivered, um, you know, diversely. The provider, people who are providers need to be as diverse and of the racial and ethnic background as the patients in order to provide true quality care. So these are
Yeah.
fixable problems, and these are just hardwired into the system that we have, which is all about the profits of the industry. Oh, and one other thing about the cost. If we move to Medicare for all, we would save one out of every $3. So it doesn't cost us money. It actually saves us money. We'd be
Yeah.
saving $500 billion a year. So it makes it all the more outrageous and inexcusable that
Wow.
our current um, elected officials have chosen not to take care of our health and instead to allow us to die and suffer from chronic disease and needless illness when they could fix it, simply by changing the system. And it wouldn't cost us anything. It would, in fact, free up a lot of money for us to put into other things that we urgently need.
Yeah.
So it's such an indictment of the system that it is this way.